Welcome back to the WHHI News. Did you know that suicide is the 11th leading cause of death here in the United States? Now, attitudes have changed over the years, but what more can we learn? We're going to find out. There was a study done recently, and joining me now is Dr. Jill Harkavy-Friedman. She is with the American Foundation for Suicide Prevention. Dr. Harkavy-Friedman, what was the most important thing you learned from this study?
Thank you so much, Lisa. What we've learned are so many important things, but the first and foremost is that more and more people understand that suicide can be prevented, at least sometimes. And more people have want to help people who might be at risk for suicide. The thing is, they don't always know exactly what to do, and they have some misconceptions about potential barriers, like they're worried they're going to say the wrong thing, or they could possibly make someone suicidal, which is not true. It's not how suicide works. It's very complex, and many factors go into it.
Well, go ahead, I'm sorry.
I was going to just say there were a couple of surprising findings, one of which is that we still have to do some more education to help people understand that limiting access to lethal means like guns and medication can actually save a life. When someone is in a crisis, those crises come on quickly and they leave quickly. And so by limiting access to lethal means, you give time, and time is their friend to both allow the crisis to de-escalate and also to maybe somebody can intervene. And if they do engage in suicidal behavior, it's much less likely that they would die for it. So understanding the connection between access to lethal means and suicide, we need to work on that.
And you're talking about, I'm sorry, you're talking about medication, but we're talking about medication, but we're also talking about access to guns and the like, correct?
Yes, exactly. Because, if you can limit that access, they're likely to make it through a crisis. And it doesn't have to be forever, but it has to be when somebody's not feeling well and they're more vulnerable to acting on it.
You also found that people really want to help, but sometimes if they're told by a friend or loved one or workplace associate that they're suicidal, but sometimes they don't know how to help or how to approach it. Is that true still?
That's true, and that's, again, why we're spending so much time on education and awareness, because most people know at least how to have a conversation, but they're not sure what to say. They worry that they're going to say the wrong thing, or the person won't tell them. And so that's why at afsp.org we have lots of information and what we call real convo guides to help you have that conversation. And also to learn how to facilitate the conversation by being non-judgmental, by listening, by letting someone know you care about them, that you're not flustered by what they are feeling. They don't need to feel embarrassed. But your role is to help them get help. You don't have to become a mental health professional. Just get them help.
Can you talk about the 3-digit number to call that you said people are aware of, some are, but they don't really realize how that all works?
Yes, so 988, which if you call it, you text it, or you go online and go to it, is the National Mental Health and Suicide Prevention line. And there will be somebody on the other end who can talk with you about what's going on and help you find resources. Now, sometimes when you call, there's going to be a pause because they're trying to link you up with local resources. That doesn't mean they don't care. It means they're trying to get you to the right place. And 80% of people who call 988 actually feel better, and about 60% of them aren't even thinking about suicide anymore. And it's very unusual, but in very extreme circumstances, they might send a crisis unit out to you to get help. But that's very unusual. And the goal is to help you get help so you feel better.
We're already out of time. Dr. Jill Harkavy-Friedman, thank you for the information today. Very useful, and hope to talk to you again in the future. Thanks so much.
Thank you so much.
And we will be right back.